This is Dr. Krishna Raj Ganesh Narayan, a periodontist by profession. There is a lot of fear among children about orthodontic treatment and about the pain that is associated. So we will be discussing about what are the things that you need to know before the orthodontic treatment and during the orthodontic treatment. Now mainly patients complain of pain following onset of orthodontic treatment, mainly because of the presence of braces. And this is quite acceptable or understandable because when you have these metal braces inside your mouth, they sometimes can cause an injury to the gums inside, they can cause injury to the soft tissues, and these will cause ulcer formations. And sometimes it's very difficult to maintain oral hygiene because food gets stuck in between those braces. So these are some of the things that you need to know and be mentally prepared for when you start with orthodontic treatment. There are several options available for orthodontic treatments today. One is the conventional metal braces that we know since decades. Then we have a little more aesthetic options like ceramic braces available, which give you a more aesthetic option. We have crystalline braces that give you a little more transparent, again a little better aesthetics. And now off late we have aligners which are literally transparent and give you the best possible aesthetic outcomes. Now many times we get asked this question, is this better, or is the aligner better than the conventional braces, or is conventional braces better than aligners? Now the point is that all these aligners are designed to align your teeth. So all of them will give you more or less similar results. Now, there are some challenges with aligners because there are certain type of tooth movements which are a little complicated, where if your teeth position is rotated, or if there are deep bites, or if there is an open bite situation, these are a little complex situations which I believe that the regular braces will give a little better treatment. But aligners are definitely good, mainly for the fact that it gives you a great aesthetics and more importantly, it allows you to eat whatever you want. A lot of time our ortho patients complain that we are not able to eat hard foods because of the presence of brackets and it breaks and things like that. But with aligners, you can always remove the aligners, eat whatever you want, brush your teeth and put those aligners back. So these advantages of aligners are there. So every system has its own advantages and disadvantages. Please make sure that you understand the advantages and disadvantages of every system before you choose what is the right option for you. A major concern among all people requiring orthodontic treatment is, doctor, will I have to get any of my teeth removed? Or is an extraction a must? Right? We never say that. Of course, we do our investigations, we do a couple of x-rays before we start, we do study models to understand how much space is needed before we start. But again, it depends upon the age of the patient and a lot of other factors. But we always start with a mindset that let us try and avoid the extractions as possible. Depending upon the kind of clinical situation that we are faced with, the age of the patient, the amount of space that is needed to achieve proper alignment and occlusion, these are very important factors to consider based on which we will decide whether extraction is necessary or not. But trust me, extractions are the last option and we will not do it unless and until it is really necessary. This is a very good question that we get routinely from patients. Patients needing orthodontic treatment and dental implants. Which one should you do first? See, when you do an orthodontic treatment, you are moving the teeth. But implants, once we place and it gets firmly embedded inside the bone, cannot be moved by any treatment, right? So if you want to move the teeth first and then place the implant. So always remember that if at all you are considering an implant treatment and if you are considering ortho treatment, it is always that we do the orthodontic treatment first, and when we reach phase 3 of ortho, that is when we achieve the final outcome, and at that time 3 months before we debond, that is remove the brackets, we can always put in the implant and make sure that you get the crown at the same time as when you get your orthodontic treatment completed. So we can coordinate it in such a way. But yes, orthodontic treatment will always come first. One of the significant questions and challenges posed by orthodontic patients is their inability to eat. And that is true because orthodontic treatment will involve placement of metal braces or ceramic braces onto your teeth, and these will firstly cause increase in the amount of saliva that your mouth produces. Yet this will also cause multiple ulcers in the first 1 or 2 weeks for you before you get adjusted, that your mouth gets adjusted to the presence of braces with them. So yes, eating hard foods, drinking aerated beverages, these are all strictly contraindicated, especially when you go with regular braces like metal or ceramic ones. But aligners give you a much better option, because you can always remove the aligners and you can consume whatever food that is that you want to, brush your teeth, maintain proper oral hygiene, and re-wear the aligners back. So the disadvantage of not able to eat hard foods or aerated beverages is completely eliminated when you use aligners. But doesn't necessarily mean that they are good for your health, but I'm just saying, as far as orthodontic treatment is concerned, having aligners overcomes a lot of these side effects that regular braces have. Well, injuries are common following any sport, right? And necessarily it doesn't mean that just because you have an orthodontic treatment should stop you from playing any sort of sport. And wearing protective gear to make sure that you're well protected during any sports is again the same whether or not you undergo the orthodontic treatment. But yes, if you have conventional braces, and if you're let's say playing football or playing cricket, or a ball comes and hits you in the face, the injury that can occur on the inner side is a little more when you're going with conventional braces, because these brackets can go into your mucosa and can cause some laceration and cause some ulcers. Nothing major, but yes, that's a possibility. And sometimes these braces break, right? And sometimes they come out of the tooth and stuff. So firstly, it's extremely important that you don't swallow any of this, because we don't want you ingesting any of these braces. Things come out. You can always, if possible, keep it with you, put it in a box or something, and then take it to your dentist on your next visit. And then the dentist can see whether they can reuse the same bracket or may give you a completely new bracket. Sometimes the wire breaks and comes out, and that can actually poke you in your gums and cause some bleeding and cause some discomfort. To prevent that, your orthodontist can give you something like a sticky wax. And next time you visit your dentist, you can always ask for a little bit of sticky wax, that you can keep it as emergency. And in case if there's some part of it that pokes in you, you can take a sticky wax and apply it on that area which is sharp, and that will act as a stopgap treatment till you visit your dentist the next time. Well, what are the foods that you need to avoid when you're wearing conventional braces like metal braces or ceramic braces, right? Metal braces are, you cannot eat nuts, right? If you try to eat anything hard like nuts or, chakli or murukku and, the typical snacks, these are things that can cause the brackets to chip away from the tooth and to break. Sometimes when we are on a mixed diet, right, you want to eat meat, and when you try to pull off the bone, there's a pressure that's caused on the brace, and that can kind of, get the braces to, the brackets to fall off. But of course, like I said, aligners will not cause any of these issues. It's only with metal braces. And for those of you who are wearing ceramic braces, there are sometimes there's discoloration of some ceramic brace, or the area around the brace can get discolored when you have caloric foods like turmeric and things like that. So these are some of the things that it's best avoided, but a regular checkup, and more importantly, to keep that area clean. You have fantastic things available now. You have good toothbrushes that are designed for orthodontic treatment that can be used during orthodontic treatment, and now you have water flossers that are fantastic to make sure that there's no food stuck in and around your braces during your braces treatment. So if you are considering aligners for yourself, then all these issues become irrelevant to you. But when you're doing regular braces, there are things and tools available to ensure that your oral cavity or your oral hygiene is maintained well.